Welcome back to another video. And in this video, we'll talk about the latest variant of SARS-CoV-2, that is the Omicron virus. You know that WHO is conducting a lot of researches in different regions of the world, and it is collecting the data, it is performing the data analysis, and it's sharing this with not only the healthcare professionals, but it is also creating the general awareness among the masses so that they can not only save themselves, but they can also protect the lives of many around them. Because you know that we have lost a lot of people in this pandemic of COVID-19, and most of them were the senior citizens. So this is basically the general awareness program related to Omicron. Let's start this video. You know that this variant of concern, which was named Omicron, it was named Omicron on the advice of WHO's Technical Advisory Group on Virus Evolution. We have the latest information about this Omicron. So, researchers in South Africa and around the world are conducting studies to better understand many aspects of Omicron and will continue to share their findings of these studies as they become available. So if you have got any information related to this variant and you know anything about it, then you can share it and you can comment below, so that this will be adding to our information and our knowledge as well. For your information, that this Omicron variant was first reported in South Africa. So basically the studies are continuing there, and we'll see now the transmissibility of this variant of SARS-CoV-2, which is called Omicron. It is not yet clear whether Omicron is more transmissible as compared to the other variants, including Delta. I hope that you remember that Delta has caused a lot of deaths in a couple of months before. This was highly transmissible. It was very lethal as compared to the other strains of the SARS-CoV-2. The number of people testing positive has risen in areas of South Africa affected by this variant, but epidemiological studies are underway to understand if it is because of Omicron or other factors. Now we'll see the severity of disease. It is not yet clear whether infection with Omicron causes more severe disease compared to infections with other variants, including Delta. However, preliminary data suggests that there are increasing rates of hospitalization in South Africa. But this may be due to increasing overall numbers of people becoming infected rather than a result of a specific infection with Omicron. There is currently no information to suggest that symptoms associated with Omicron are different from those from other variants. Initial reported infections were among university students, younger individuals, who tend to have more mild disease. But understanding the level of severity of the Omicron variant will take days to several weeks. All variants of COVID-19, including the Delta variant that is dominant worldwide, can cause severe disease or death, in particular for the most vulnerable people, and thus prevention is always the key. Let's see the effectiveness of prior SARS-CoV-2 infection. Preliminary evidence suggests there may be an increased risk of reinfection with Omicron, that is, people who have previously had COVID-19 could become reinfected more easily with Omicron as compared to other variants of concern. But information is limited. More information on this will become available in the coming days and weeks soon. Let's see the effectiveness of vaccines against this Omicron. So WHO is working with technical partners to understand the potential impact of this variant on our existing countermeasures, including vaccines. Vaccines remain critical to reducing severe disease and death, including against the dominant circulating variant Delta. Current vaccines remain effective against severe disease and death. Effectiveness of current tests. The widely used PCR tests continue to detect infection, including infection with Omicron, as we have seen with other variants as well. Studies are ongoing to determine whether there is any impact on other types of tests, including rapid antigen detection tests. Effectiveness of current treatments. Corticosteroids and IL-6 receptor blockers will still be effective for managing patients with severe COVID 19. Other treatments will be assessed to see if they are still as effective given the changes to parts of the virus in the Omicron variant. Now, the important thing, that is the recommended actions for people. So I have listed few things and I hope that you know about them. So the most effective steps individuals can take to reduce the spread of the COVID-19 virus is to keep a physical distance of at least 1 meter from others. Wear a well-fitting mask, open windows to improve ventilation, avoid poorly ventilated or crowded spaces, keep hands clean, cough or sneeze into a bent elbow or tissue, and get vaccinated when it's their turn. WHO will continue to provide updates as more information becomes available, including following meetings of the TAG VE. In addition, information will be available on WHO's digital and social media platforms. So stay informed and keep informing others. Thank you.